Welcome to a mini lesson for your nursing exams. See more tips below in the comments. Also, add your thoughts or useful tips below in the comment section. Now, let's get started. Therapeutic procedures. Methods to help the patient's condition improve are the use of an embolectomy and Vena Cava filter. What is an embolectomy? This is surgical removal of the embolus. Important nursing actions for an embolectomy are the following. Prepare the client for the procedure, such as maintaining an NPO status and verifying informed consent. Monitor post-operatively vital signs, incision drainage and pain. Vena Cava filter. This is the insertion of a filter in the vena cava to prevent further emboli from reaching the pulmonary vasculature. Important nursing actions for a Vena Cava filter are the following. Prepare the client for the procedure. Monitor post-operatively. As a nurse, one of the most important education topics are the following. If homebound, set up home care services to perform weekly blood draws. For severe dyspnea, set up referral services to supply portable oxygen. Follow recommendations for prevention of a PE. If smoking, consider smoking cessation. Avoid long periods of immobility. Perform physical activity such as walking. Wear compression stockings to promote circulation. Avoid crossing the legs. If taking warfarin, do not increase or decrease the amount of vitamin K foods consumed. Green leafy vegetables. Vitamin K can reduce the anticoagulant effects of warfarin. Adhere to a schedule for monitoring PT and INR and follow instructions regarding medication dosage adjustments and regular blood draws. There is an increased risk for bruising and bleeding. Avoid taking aspirin products unless specified by the provider. Check the mouth and skin daily for bleeding and bruising. Use electric shavers and soft bristled toothbrushes. Avoid blowing the nose hard and gently apply pressure if nosebleeds occur. If traveling, take measures to prevent PE. Arise from a sitting position for 5 minutes out of every hour. Wear support stockings. Remain hydrated by drinking plenty of water. Perform active ROM exercises when sitting, ankle pump exercises. Complications. With PE, the most common complications are decreased cardiac output and hemorrhage. The most important skill as a nurse is to prevent such complications by learning to identify early signs. Let's talk about the complication of a decreased cardiac output. Decreased cardiac output occurs when the blood volume is decreased. Important nursing actions for decreased cardiac output are the following. Monitor for hypotension, tachycardia, cyanosis, jugular venous distension and syncope. Assess for the presence of specific heart sounds. Initiate and maintain IV access. Monitor urinary output, which should be 30 ml per hour or more. Administer IV fluids to replace vascular volume. Continuously monitor the ECG. Monitor pulmonary pressures. IV fluids can contribute to pulmonary hypertension for clients who have right-sided heart failure. Administer inotropic agents to increase myocardial contractility. Vasodilators can be needed if pulmonary artery pressure is high enough to interfere with cardiac contractility. Hemorrhage. Hemorrhage is a risk due to anticoagulant therapy, which results in bleeding. Important nursing actions for hemorrhage are the following. Assess for bleeding from or bruising around injection and surgical sites at least every 2 hours. Monitor cardiovascular status such as blood pressure, heart rate and rhythm. Monitor CBC, which includes the hemoglobin, hematocrit and platelets. Monitor bleeding times with the use of the PT, APTT, INR. Administer IV fluids and blood products as required. Test stool, urine and emesis for occult blood. Monitor for internal bleeding at least every 8 hours. Have antidote available for use if necessary. Well, that ends the lesson on pulmonary embolism. Check out our other nursing videos to help make studying easier. Also, see below for useful links that take you to NCLEX style quizzes, nursing study guides, and more. Thanks for watching.